So, cosechando éxito. It's very interesting what we have here. I'm going to give you an introduction of Latino Surgical Society. It was established to cultivate, nurture, and support the advancement of Latino surgeons. Before this, we actually didn't have a place to go. We went to all this conference, but we didn't have a common place where we can meet, share our experience, and actually show each other people that talk like you with maybe similar experiences what we can do in this surgical world. So these four visionaries got together, and it was actually their vision that created this. They got together one time, and as you can see there, they're very well recognized academic surgeons, and got together and said, we need something to guide us for the future. And that's what they did. Dr. Romero, Dr. Fernandez, Dr. Lopez, and Dr. Ortega got together and then created the Latino Surgical Society. But they don't only create it by themselves, they created it for us and mostly for you guys coming up in training. The advisory board, as you can see, is a very diverse and great group of people that we actually have read their names in chapters, have seen speaking. We even have Dr. Pellegrini, which is one of the ex-presidents of the American College of Surgeons, being one of our advisors. So what we offer is a whole range of different specialties and different Latino surgeons that can help guide your experience and be a part of something important. And the programming is actually very varied, and it has different things. And I invited you all to participate. It's all being made with you in with a mindset of helping you through your career grow, meet people, and just meet people like you that are actually going through the same experiences and can share the experience with you and the knowledge that got them there. And I encourage you all to participate in all of this. Cafecito with LSS, is pretty much having a coffee with your fellow residents. You discuss a topic, and this happens often. So in Sussex, like we're doing now, is being done in other specialties. We have the pleasure today to do it in vascular surgery. My favorite one, inside the operating room. You get an expert. In this case, we have the picture of Dr. Vasquez here, who was the chairwoman of surgery at the University of Miami, and he's a vascular surgeon. And she can take you through a case and explain how she does things. So you get access to experts. You get access to people that have done this before you, that have trained and have probably the answer that can get you get through that. But not only that, there's a lot of growth that's been happening with the society. Right now, they actually have a seat in the American Board of Surgery. The American Journal of Surgery just became the official journal for the Latino Surgical Society. So there's an opportunity for you to publish, and there's partnerships with multiple different organizations that you can become a part of it, and that actually will increase and impact the people you meet. Your academic work will be disseminated more. The best part of it is every 2 years there's the Latino Surgical Society Symposium. Last year it was done in Seattle. Actually, this year it was in Seattle. The University of Washington was hosting, and you're able to go there and present your work, your research work, meet other people, and become, continue becoming part of this society. It's great networking event. Not here on the slides, but one of my favorite events is in the American College of Surgeons. The day before it starts, there's usually a luncheon from the Latino Surgical Society. This year in San Francisco, it was at the Mexican consulate. We were kind enough to give us space, and we had this great networking experience there. Everybody was there, and we were able to meet each other, form partnerships, and actually plan work for the future. It was actually very good for me, and I hope it was very good for the residents and students that were there. Right now, this is how the society leadership looks like, Doctor. This is the first year that there's a president, and it has more of this structure. Dr. Romero, one of the founders, is the president. Dr. Fernandez is the vice president. Dr. Reina is the secretary, and Dr. Lopez is the treasurer. And you can see that there's so much diversity in surgical specialties, right? So anything you need, any specialty that is actually appeals to you, there's a chance for you to actually meet the right people and form that networking. And we're expanding, right? So now I'm actually in charge, or one of the people in charge of doing the Latinos in vascular surgery. We are actually trying to become affiliated to the Society of Vascular Surgery to do it. And I think LSS is going to help us get there so we can integrate everybody. So I'm actually working now in getting this going. But as you can see, all the specialties, the plan is for all the specialties to be represented. So as I already said, what are the benefits of being an LSS member? You can get role models. You get access directly to Dr. Pellegrini, ex-president of the ACS, and all the amazing people that are part of this group, where you can actually ask questions, have them be your mentor, and help you, guide you through the rest of your career. So whoever's not part of the Latino Surgical Society, I will urge you to join. It's gonna be great. There's so much opportunities of growth, of development, and they can help guide the rest of your career. So you can see here is all the information, but I'm sure Haldo and everybody else will have it available for you later. I am gonna stop sharing my screen, and we're gonna continue. We have the privilege now. Dr. Abril is gonna be our running the panel. She's gonna be the moderator, and she's gonna take us through this very interesting group of panelists that are gonna tell us about their experience in vascular surgery. So, thank you, everyone. I don't know how to stop sharing. Yes, here. Thank you. If there's no any questions, I'm gonna leave you guys with Dr. Abril.
Hi, everyone. I'm Gabriela Abril. I'm a fourth-year resident at New York Presbyterian Brooklyn Methodist right now. I'm going to be introducing our panelists. First, we're going to be starting with Dr. Daniel Delgadillo. He is currently a vascular surgery fellow at UC Irvine. Thank you so much for being here today.
Hey, thank you all. Yeah, my name's Daniel. I'm from Southern California. Born and raised, went to undergrad at Cal State San Bernardino, did 2 postbacs, one at UC Riverside, one at UC San Diego, and then finally found my way in medical school over at Michigan State. After going to Michigan State, I matched into categorical position general surgery over in Bakersfield. It wasn't short long after I got there that I realized this program was on the brinks of shutting down. And so then I was offered some places to go, but finished my training over at Cedars-Sinai Medical Center in Beverly Hills. And now I'm subsequently over at UC Irvine for my vascular surgery fellowship. Kind of a very non-traditional route, and have gone through a lot of different weeds to get where I am today. So happy to answer any questions that anyone can think of.
Excellent. Thank you so much. Next, I'm going to introduce Dr. Imani McElroy. She is currently a vascular fellow at University of California, Southern California. She's a California native. Imani grew up in Oakland, California, where she witnessed firsthand how healthcare disparities related to vascular surgery can impact your everyday life. She graduated from the Charles R. Drew UCLA Medical Education Program before heading to Mass General for her general surgery residency. While there, she completed a master's in public health at Harvard T.H. Chan School of Public Health with a focus on community health and organizing. She is currently in her first year at the UCS LAG Vascular Surgery Program, with hopes to remain in California to start her practice. Thank you, Dr. McElroy.
Hi, everyone. Happy to be here. Happy to answer any questions you have.
Okay. And then we have Dr. Paula Morales Allende. She's a 5th-year vascular resident at Montefiore. She's originally from Argentina. Dr. Morales Allende grew up in Queens, New York, and developed a passion for vascular surgery from her research experience at Barnard College. She attended Albert Einstein College of Medicine, is currently an integrated vascular surgery chief resident at Montefiore Medical Center. I think she is currently in the operating room and might join us.
She's actually back. We're working on her audio, and I'm going to have her back pretty soon.
Excellent, excellent. Thank you so much. And lastly, I have Dr. Karen Velez. She's a 2nd-year resident at Montefiore. Dr. Velez is a vascular surgery integrated 2nd-year resident at Montefiore. She was born in the U.S. and raised in Mexico. She obtained her MD from the Monterrey Institute of Technology in Monterrey, Mexico, followed by a postdoctoral research fellowship in cardiac surgery at Johns Hopkins. She then matched into general surgery at Montefiore and joined the vascular surgery integrated program as a PGY2. Outside residency, she loves to run, take care of her plants, read novels, and travel the world with her husband.
Thanks for having me.
Okay, so while we get Dr. Morales Allende, I'm going to start off with a very broad question. And just to begin, can each of you share why you chose vascular surgery? And I can go with Dr. McElroy.
Okay. I grew up in the Bay Area, and like I said, I had a lot of family members that I didn't know at the time were dealing very closely with vascular surgeons. They were diabetics, they had fistulas, they were getting TOEs, they were getting angiograms, and ended up with amputations. So growing up, my life revolved around vascular patients and helping take care of them. But when I got to medical school, actually, the first surgeon I shadowed happened to be a vascular surgeon, and she was the head of the Women in Surgery Interest Group. And she invited me out to her clinic, and I think it started there. I didn't know what vascular was before that, and I think she really started to help me understand what I had witnessed growing up so much with my family. And I think the road for vascular to me has all been about mentorship. Dr. O'Connell really invested in me and my education, but also me as a person, and really helped vascular become accessible to me. And so when it came time to apply to residency, I did a trauma rotation at Harbor UCLA, where I did most of my rotations, and then I did a sub-I at Highland Hospital, where I originally thought I wanted to do training. And so I fell in love with trauma, and she decided that you could apply integrated, you could apply general surgery, but do what's going to make you happy. She said, go out and explore the world, go have a great time. If you love vascular, it'll always be there when you come back, and I'll support you throughout that process. So when I got to residency, I obviously went the general surgery route. I ran into another phenomenal mentor of mine, who is still a good dear friend. And I think the hesitation a lot of people have about vascular, especially, is kind of the endovascular stuff. Everything is sexy about it, big open vascular cases. Like, I just did a aorto by iliac case, and it was a great open case, but like the good portion of my time here in training is also doing endovascular, which can be very confusing and be esoteric and very different for people who don't really, whose brains don't always work that way. Like, my chair's an amazing human being, and the way his brain works for big aortic cases, I'm not there yet. I hope to be there, but I'm not there yet. So it can make vascular a little bit inaccessible to some other people. And then, especially when you're just standing there holding the wire as a med student. But I had another mentor who, again, not just invested in me in the OR, invested in me outside of the OR, but he made endovascular accessible to me. And he helped me understand, especially once I started doing my public health work, like how I could use vascular surgery as a way to really be impactful and really impact disparities care, and community level care and advocacy. And so they were able to mesh my love of advocacy, my love of the community, with my love of being in the OR and doing very technical things, and somehow made this very crazy, hard to understand thing that, when you're learning, it really is about learning how to manipulate the wire yourself, but it's not like you can show someone how to throw a stitch. You can be like, yeah, float this wire. And then you're like, so he made it accessible to me. So when it came time to choose between trauma and vascular, it was a no-brainer. Between dedicated faculty, I was able to mesh all aspects of my life. And I think the beauty of being a vascular surgeon is also we get to be super creative. So people who like creativity, like there's all these different ways you reconstruct vessels or past lesions. And so you really get to use, I guess, that left side of your brain and, and explore and really fall in love with the field. And there's so many different subspecialties. Within it, you can do veins, you can do PAD, you can do diabetic foot, you can do aortic stuff, you can do cerebrovascular. So I think as someone who has a lot of interest, it's just never going to be boring. So that's my very long-winded answer why I chose vascular, but it's clearly you can tell I love it a lot. So
I was gonna say yes, I can. Dr. Delgadillo, do you have anything to add?
Yeah. So my interest in vascular surgery kind of didn't come until I was in residency. It was like my second, third year. And I really didn't know fully what vascular surgery meant. I didn't know what it was to be a vascular surgeon. If you ask half of the doctors that you see in your hospital what a vascular surgeon does, 90% of them are going to say, well, I have no idea. Don't they work on the heart? Yeah. Don't they, I don't know. They don't know what we do. No one knows what we do. And it's even hard for us to figure out what we do as you define your own role in your own hospital and in the community. But what I reflected back on when I was on those rotations was the work I did with my father growing up. My dad's a landscaper. I did a lot of commercial and residential irrigation design. And so reflecting back on those times when I would lead a crew of, 2 men and myself as like a 16-year-old guy to go knock out these irrigation jobs, I realized everything was connected to this pump, and that pump had pipes in which it would kind of flow and then things would kind of drain back. And if you break it down to that, it's kind of like vascular surgery. Your heart is your pump, your arteries are your outflow, and then you have your inflow, but it's pushing outwards, and then you have your veins which kind of come back. And for arterial disease, when you think about it, it's like, hey, you have blockages. You can either go around the blockage and do a bypass, you can cut the blockage out, do like an interposition, or you can go through it and do endovascular. And that's kind of the same way we would do, some of these projects, right? We would have to either go around and build around the irrigation system or build through it. And it's a lot of similarities. So it really started resonating with me. And then further, I reflected back on my upbringing and my grandmother always saying, you're going to be my doctor, you're going to be my doctor. Well, she suffered from diabetes and all the complications as you can imagine. And so it all just kind of resonated that vascular surgery was for me. Additionally, I kind of loved the part that allowed for continuity of care. You get to see these patients, they're, repeat offenders, if you will. You see them for their foot, you see them for their dialysis access, you see them for their amputation and their carotid disease. And now, they're doing a, cabbage or something, and now they're doing PCI of the cabbage, but they have some left subclavian artery stenosis. So you're stenting the subclavian open so they can get to the lima, and you're finding yourself doing a lot of work to really help these patients. So you get to see them. And then unfortunately, at least here in Santa Ana and Orange, we get to see their younger generation. So you're not only treating the parents, but now you're treating, their kids, and trying to help change that stuff. So I always talk with the little, kids that are in there, and just, make sure you're exercising, dieting, eating healthy, and really, trying to create a positive change there. But yeah, that's my long-winded answer.
Thank you. And I think Dr. Paula Morales Allende is with us right now. So I'm just inviting her to join. I don't think we can hear can't hear you, Dr. Morales. I think you're muted.
Yeah, sorry guys, I'm late, but we have a AAA that still I have to scrub back into, but it's been kind of a disaster all day. Pros and cons of vascular surgery. But the reason I decided to become a vascular surgeon is in college, I was doing some research with rats, and it involved using like technical skills to access certain facial nerves, and I fell in love with the technique of it. And I started shadowing a Barnard alum who was doing general surgery, and she was on her vascular surgery rotation at the time. So I fell in love with all the procedures. I tried doing other things in med school and shadowing other specialties, but at the end of the day, I just love the procedure. I like that you're kind of like the plumber of the body, and you have to reroute blood and use all these creative ways to reestablish flow. And I did like that it was open and endovascular, and you kind of have to get creative. So I really enjoyed all of that. And yeah, that's pretty much how I got involved. And since I knew from so long that I wanted to do vascular surgery, I went the integrated vascular route. So I saved myself 2 years basically of doing a fellowship. So that's pretty much my story.
Great. And I think Dr. Velez, it might just be you in the view, but there's anything that you want to add.
Yeah, so for me, I didn't know I wanted to do vascular because I didn't have that exposure during medical school. It wasn't until I started my general surgery residency that I realized that's the field that I like the most. And what I like the most about vascular surgery, like others have said, is the unique pathophysiology. I think it's very interesting. I think it's very complex and personalized, and no two patients are the same. There's so much variation in their anatomy and their goals and their physiology, and our treatment, I think, is really tailored to their needs, and it requires a lot of preoperative planning. And I think that is just very stimulating as a surgeon. And on that note, also, like Paula said, like diversity of the procedures, you can do from open to endoscopic cases, and you're operating in basically all parts of the body. And I think there's very few surgical specialties that offer you that variety. And that's something that I really loved about vascular. And like others have said, the relationship that you build with your patients and their families long term, I think that's also very rewarding.
For sure. Thank you so much. I think a few of you might have touched upon this, but I think a question I hear often from, particularly from people coming from general surgery that are interested in going into vascular surgery, are two main concerns. The first one is radiation exposure. And the second one is what percentage of endovascular surgery do you end up finding yourself doing at the end of the day compared to open vascular surgery? And so I think Dr. McElroy might have been the first person to touch upon that a little bit. If maybe you can elucidate.
Yeah, I think obviously endo is a big part of our practice. But I think I know that it's also going to be dictated by where you practice and, you know, what, especially when you're picking a program. Like I picked a program where I knew we did a lot of open cases. There are programs that are out there that, you know that, you know, you're going to do like 90% of your cases endo, or you're going to be a heavy endo place, or if you go to Methodist, you're going to do robotic cases. You know, there's other places that are known to do a little bit more open. But I think the best you can try and ask for is going to be like a 50-50, 60-40 split. And I think the key to that is because endo has an important part of our care. Endo can be really life-changing for a lot of patients. And understanding endo and when to do endo is important, and understanding open and when to do open is very important. And so being completely in one direction can be useful, but especially for someone like me, where I feel that my goal is to practice in a community setting. And so that means I kind of have to do the jack of all trades kind of route. And so I have to be good at everything. I have to be proficient. I have to be on top of everything. And that's also why I do love vascular surgery, is because it allows me to be able to flex all those different skills I've learned through the general surgery training route. But yeah, I think that's the big conversation everybody thinks of. And I have a few friends who've ended up going into vascular, but their big fear was like, I don't like endovascular. And I was like, you probably don't understand endovascular is the better way to state that answer. But I think when you're looking for a program, your goal is to find one that's going to have the breadth of the practice. Unless you really know you want to be an aortic surgeon and like you want to do endovascular, like, you know, TAMBs and PMEGs and all those FEVARs and BFEVARs, sure. Like if that's your jam, then go for it. But I wouldn't rule out especially, you know, the open lower extremity access, because a lot of patients are going to need that. And then also it's just, like I said, I think someone else was saying, is vascular so tailored to each patient? It's in your best interest to have that breadth. And there's a lot of programs that do offer that. And then I also talked to a lot of people who are like, oh yeah, like when I left fellowship, I was going to be an aortic surgeon, and they're doing nothing but PAD. So you really do have to be able to be flexible enough to get a job to make yourself competitive. Like, you know, I for sure have zero desire to do TAMBs after fellowship because they give me heartburn. But like, I'm going to leave here, and if I have to go somewhere and the only job is like, you're going to be the TAMB person, I guess that's going to be my practice for the first few years of my career. So you know, it is what it is. But I would also say give endo a chance. It really can be, you know, a really enjoyable experience, especially when you take someone from a BKA to a TMA. So, and that's, you know, that's a really life-changing experience for people. So.
Thank you. Dr. Delgadillo, maybe something to add on radiation exposure or your experience with endo.
Yeah, I definitely, you know, hear the concern and could appreciate it. But I think that it's also important to know that there are several ways to kind of protect yourself from radiation. You know, you're constantly using lead shields, you're adding extension tubing, you're kind of getting yourself away from direct radiation. You know, you're wearing glasses, you're doing as much as you can to protect yourself. And I think that when you train in places with good people, they are also there to protect you. And I think that's kind of important. I think that, you know, Yeah, I mean, I think I'm at a program where we do probably 60-40, but I think it's really important, like was mentioned, you have to understand the benefits of endovascular interventions on some of these patients who are sick. You have a patient who's super, super, super sick, and you want to take them to do a bypass as opposed to trying to go in there and recan their SFA. The chance of them having a heart attack goes up. Operation time goes up. Like there are so many variables to that could really, put your patient at a higher risk. And you have to understand that. So, yeah, there's radiation involved, it is. Yeah, but there are ways at least to kind of lessen that and protect yourself, which I think is important to kind of make sure you exhaust all those avenues while you're doing it.
I also just want to add the lead is becoming, it's state of the art. They're coming up with all these new ways to make lead comfortable and ergonomic. I have the very, very cool hip shoulder pads and, and shin guards that people laugh at me for, but you know what? I wear them. And then they actually have like these new companies that are trying to find ways to like decrease radiation to the patient and decrease the spray. So like they're saying like, there's shields, there's special beds, like everybody knows that we're having radiation and we all know we want to decrease it. But for me, I was willing to take the risk, but like I said, I mean, you can get your own leopard print. My intern has cheetah print lead. So like it's your own way to like be personalized in the OR is how I see it. So just like a scrub cap, everybody has their own lead too. But yeah. Otherwise, very valid points.
And you should wear your radiation badge so you know how much exposure you're getting. So there's a limit. And most people, don't reach that limit anyway.
Can I make a point about that? I actually think this is one of the best questions to ask, right? It's a risk. It's a risk that maybe other specialties are not exposed to, right? But you learn to protect yourself. You learn to protect yourself, your patients, and your trainees and the people around you, right? And you become kind of an expert in calculating doses. And one paper that came recently showed that female orthopedic surgeons were having a higher risk of breast cancer, because if you notice, the lead vests actually don't cover the side of the breast. So now there's been this new revolution of creating new technology of lead that actually extends. So most of our female trainees and most of our female orthopedic surgeons have all gotten the new technology. You learn how to protect yourself, you learn how to protect others, but the technology is actually getting much better. I would love everyone to read the paper by Dr. Dietrich. He's the guy from the Arizona Heart Institute that pretty much shows how to do endovascular. And he died of brain cancer, and he had cataracts, and he had thyroid cancer, and he had every possible complication you can get. But he tells a story of how we didn't know, and now we know, and we should be better. That's the point I just wanted to make. Thank you, all of you, for the points you're making.
Sorry, I think I was muted. I think that's one of the major concerns we get. So thank you so much for answering that. And just to go off a few of your answers, how did you go about finding the program that best suited your interests and needs? I know, Dr. Elroy, you mentioned that you picked the program that was mostly open. How did you find what each program did?
You just ask, and programs have reputations. It's like everybody knows UCLA doesn't have a hybrid room. It's kind of like the worst kept secret in vascular surgery. Supposedly they're getting one soon, but they've been also saying that since I was a med student. So but shout out to UCLA, my crosstown rivals. But no, you just ask around, and then you can also look to see, like, you can look at the chair. This is all, information. Look at the chair of the department, or the chief, depending on how the department says it, and figure out what they're known for. And that can help dictate. You can just look to see, you look to see what people are publishing in, and you figure out what institutions the publishing things are coming out of. And then also just look at where the practice is, Daniel and I both practice in parts of Southern California that have large indigent populations and deal with a lot of true end-stage vascular disease processes, because our hospitals have such large catchment areas. And so for me, like, I knew that at SC, I would have Keck with the academic, you know, fancy devices and everything. I'd be at county, which is under resourced. Like we barely have any graphs on the shelves. Like we have to call our reps every time we have a case. And I knew I'd be out in the community in Verdugo and Arcadia. And so kind of that same resource limited environment. And so when I was applying to programs, I wanted to be at programs that didn't just have all the great cutting edge things. I wanted to learn how to function and work in an environment I saw myself practicing in. And that's all information that one, you'll get on interviews, but also just from talking to trainees or just looking at where hospitals are and what they sell when you look at their websites. And Keck sells itself as, you know, being the front of aortic care, and then county sells itself as being the forefront of, you know, podiatric and diabetic foot and peripheral arterial disease. So you just have to talk to people.
Okay.
I went to, oh, sorry. I went to medical school here, so I knew Montefiore and I knew I wanted to stay in New York. I knew the people here, so it was kind of like a given. Like I you know, I was okay with staying around. Some people are you know, kind of constrained geographically, and I think I was at the time. I wanted to stay in New York, and now I want to branch out. But you know, I also wanted to stay and be around minority communities, and there's a big Latino population here, so I wanted to stay with that. And I think, you know, I got everything out of the program. I have a few months left, and you know, it's been really rewarding, difficult, and very busy. But I think I learned a lot, and at the same time, it did feel like I was giving back to my community here.
Now, going a little bit more into the application process, when, and I think most of you might have already touched upon when, but what steps did you take to prepare a competitive application for vascular surgery? And maybe we can start with Dr. Velez.
Yeah, so for me, it was sort of a non-traditional path because I applied to general surgery and then was transferred to the integrated program at my institution. But as a foreign medical graduate, something that I think applies to any surgical specialty, and something that I think helped me a lot in my application was doing research before applying to residency. So I worked at a large animal lab over at Hopkins, and I think that really helped me get very good mentors and some publications and really good letters of recommendation. And that, for me, I think that was very helpful. Having really good mentors, I think it's very important in the application process, whether that's for general surgery or for vascular surgery. But I think even more so in vascular surgery, because it's such a tight community that everyone knows everyone. So I think if you have a good relationship, with a mentor, I think that can go a long way. So that would be my advice, you know, try to get good mentors, and research also always looks good in your application.
Dr. Delgadillo, how important do you think research is coming, like research experience in vascular surgery for the vascular surgery application?
Yeah, I think it's important. And I think it just depends on what you're looking for in a program, right? I think there are a lot of programs that we all kind of know, whether we want to admit it or not. There are tiers to certain programs that we know they're going to recruit the highest qualified applicants, right? Which means that they have all the research, they have the ABSITE scores, they have the STEP scores. If they're, I guess, I don't even know. I guess they don't even have STEP anymore, right? I mean, I think it's like pass fail now. I don't know what they do for people, you know, coming out. Well, I took STEP 1 and 2, and there were scores assigned to that. But ultimately, they look at those things, you know, and I think that it's important if you want to match at a top tier place, like you want to be the aorta guy, open aorta, and you want to go to Penn, and that's where you want to get your training, then you have to be prepared to have that application ready to go. If you're more interested in going into the community, there are tons of vascular, there are several vascular community programs that would be more favorable and say, well, you know, you don't have too much research, but at least you meet all these other kind of criterias. If you want to be in a hybrid place, you know, again, it's having some, you know, some publications, book chapters, presentations, those things. I think it's important. But I would just echo that, you know, reaching out and seeing, you know, talking with the vascular surgeons in your hospital or the vascular surgeons, you know, most of them are pretty good people, and there's a huge need for vascular surgeons across the country. So most people are going to say, hey, yeah, I'll have a second to chat with you. What questions do you have? And I think that just getting to know some people, they'll kind of lead you in the right way, kind of set you up on projects. I was lucky, I was at Cedars, and working with Dr. Aziz today. He kind of just took me under his wing. And next thing I knew, like, I was on book chapters and abstracts and applying all this kind of thing. And it was great, and allowed me to kind of tap into some of the academic side of things that I hadn't really done before in vascular surgery. I had some other publications in other areas, but it kind of helped out. And I think when I talked to my program afterwards, after they kind of matched me, they do care about research and stuff like that. But again, I think it just depends on if you're leaning more towards an academic place, if you're leaning more towards a community place.
Yeah, I think I probably took the least traditional route in that sense. I have very limited hardcore vascular research. The majority of my connections within vascular actually came from the Audible Bleeding podcast, which I serve as the managing editor of. And I originally, like I said, went out into the lab and I was going to go into trauma surgery. So my research is mostly in trauma. But then I also, my lab time coincided with COVID. And, like I said, social justice and community outreach are a big part of what I do, and have always done. And so my CV doesn't necessarily reflect the traditional academic. Like, I think I said I have like maybe 2 first author publications, maybe 3 or 4. And I have like a bunch of other stuff. Like, I've helped write papers. I helped Dr. Anaya Tadua set up her TEG lab. And so I have a bunch of second and third author publications, but a lot of the work that I did came from one, Audible Bleeding, because those, I guess, end up on a CV. But then a lot of my other work was done at the community level, was doing outreach programs, was participating in webinars about COVID, was working with family members who run not-for-profit organizations. And so when I talked to my program, and part of why we felt that we meshed really well in that sense was because we understand that vascular has disparities. We have some of the worst disparities within healthcare because our patients are everybody's patients, and I think a lot of times in general surgery, especially because, as we said earlier, people don't know what vascular surgeons do. Like, I couldn't tell you the number of times other doctors have been like, so you guys do this, and I'm like, absolutely not. So we can't even market ourselves within vascular, within surgery, within the hospital, let alone outside in the community. And so my program was like, yeah, we don't care that you haven't written a lot of papers, but we see your passion for your community. We see who you are going to be for your patients. And we see this other aspect of medicine that is continuing to grow as people are starting to branch out into the not so nice things, like talking about politics and all those things. As I got chastised a few times for talking about politics, and I was like, well, I'm gonna talk about them. But that's what I have become known for. And my program appreciated that, and appreciated that I was going to be able to go out there and fight for my patients in that way. And so I think for those people that I don't particularly like research. I like research I care about, which for me is diabetic foot, and mental health within vascular patients, which is not a big, got going to the VAM and stuff like that, but one day it will, I swear. But
Please.
I think, but I think that's what it is like vascular surgeons, because they take care of some of the, sickest patients in the world. They take care of some of the most high risk patients. Like, we truly understand the humanity of our patients. And so we see the humanity in our trainees, we see the humanity in each other. So as long as you're passionate about whatever you're talking about and within vascular, that's also fine too. Like, I don't want people to also worry that they have to have like 40 publications to get into fellowship. Like, I guarantee you can get in with 2, because I did. Just be passionate about vascular, and I think there is a big testament. It's a very small community. And I think that's why Audible Bleeding was great for me, is because I was coming as this unknown from the trauma world into vascular. And it was a very quick way to network and meet a lot of people and collaborate that way. And so, don't be afraid to take the less traditional academic route as well. And if anybody wants to be on the podcast, let me know.
I was gonna say, can you add the resource to the
Yes,
chat?
I
maybe?
will. Yes, I will drop my email in the chat.
For everyone, Olive Oil
Or
Bleeding is an excellent resource, an excellent podcast. So any medical students, any residents here, highly,
yeah,
highly recommend it. I mean, you learn so much, you see perspective, you see a case described from beginning to end, you can see the experts on the field, how they failed, how they did it better, and I highly, highly recommend it. So shout out
I
to
just changed
very
my name
and everyone who
to
does it.
my email. So my email is now my name. Yes, exactly. We have we have sub series just for the medical students. We have series for everybody. So please, if you're interested, or if you just want to hear what we're about, it's audiblebleeding.com. And yeah, and just email me. My email is now my name. So if you have any interest.
So I agree with that. Like, you don't have to be super academic or super dedicated to research, but something I did, and I know that it really helped my application because I met excellent people, is I don't know what year you guys are in medical school, but because I knew I wanted to go into vascular surgery, I think it was like around now or November, December, I applied to a T35 program at Beth Israel in Boston. And it's mostly for minority medical students who want to do vascular surgery. And it's a summer of research, and you get to meet all these people that write all these books. And I met Dr. Chekhov, who one of our textbook is by, Dr. Wires, chapters in books, and all these people wrote me recommendation letters because they met me and they worked with me. And also you get that experience with vascular surgery research. And I went back to BI, my fourth year to do a sub-I there. So then, I got to work with them a little bit closer, but I think that really helped my application. So if you guys are interested, it's a T35 program at Beth Israel in Boston for vascular surgery.
I think you touched upon another big point for vascular surgery or in general any application, but who should you be asking for letters of recommendation? Dr. Velez?
I mean, your mentors, of course, if you have any mentors. And I think, people that, are well situated in the vascular world, or more seniors, that may know more people, or that they have been in the field for a little bit, or have worked at other places as well. Like if there might be someone that just graduated from fellowship and they've just been in a certain area and you want to maybe go to another part of the country for training, so you got to also think about that, what kind of exposure they have. But at the end of the day, they all know each other because they go to these big conferences. But I would say your mentors and people that you've worked with the most, because those are the persons that are going to write a genuine letter, and you can tell when a letter is genuine and it's someone who really knows you versus someone that's just like copy pasting something they found on the internet. So I think that's important. Someone that will make a personal letter, I think, stands out the most.
For the fellowship route, it's kind of more structured. You have to have your program director write a letter for you. You have to have, I believe, the chair of your department, or it has to be the chair of the vascular division, write a letter. So it's kind of have a letter crossed off already. And then from there, yeah, it's always, anytime you ask for letters of rec, always go with people who know you well. Or if they're willing, if they're more junior and they're not as well known, but they can help your letter writer write a letter, have them potentially help them write a letter. But we definitely can read letters and tell, like I sit in the admissions committees for my med school, and I did admissions for my residency, and like we can tell who's people actually know who's writing what. But in general, even for when I was applying to general surgery, you have to have your program director, you have to have your chair of your department, those are, and then you usually find the person you do research with or you work closely with. And yeah, but it's, a mentor goes a long way.
All right, kicking back in from a guy who interviews and writes letters to you. We all know each other, and there's a lot of signaling in the notes. But what I like is the passion that someone that really knows you can write about you. So I'd rather take a person that I don't know maybe a junior vascular faculty, but really knows you, really knows what you're about and your passion, and it reflects on that letter. So don't always look for the big name. Look for someone that can actually tell me a lot about you that in my 15, 20-minute interview I cannot get. And that goes a long way. So go like everybody says, like Paula said, like Dr. McElroy said, like Dr. Delgadillo said, Dr. Bella said, go everywhere, go do your rotations outside if you can, stay local if you can, but get someone that really knows you and can really reflect your passion for vascular surgery and how they feel, how you will fit on the field. Because I would trust that more than, like Dr. Velez said, like a generic letter that I know it was done with ChatGPT and doesn't actually reflect who you are as a person. So that's my advice. Show your passion and have someone that knows it, reflect it, and tell us about it.
Dr.
The one thing I
Rivera,
was gonna, oh, sorry, I wanted to add about the picking a program thing, which I think Paula, you mentioned it. It's like we're talking about where you were kind of landlocked to being in New York when you're picking your program. I think there's a testament to say, especially even in today's political environment, but also for me, coming from an underprivileged background, like there's only certain places I could go. And there's only certain places I was willing to live. And so when I applied to fellowship, people were like, oh, I applied to like 40 programs. I was like, I could only live in 4 states in this country. So I was basically bi-coastal in my applications. And that was for residency as well. And so I personally knew that I was only going to be able to live in certain states. And then also looking at cost of living, like, it's a very real thing. Medicine is expensive. It is 100% a scam, how much that we expend to be doctors. So I am all for, I was given phenomenal advice when leaving MGH to be like, go somewhere new. Like you've known us for 7 years, like go learn something different. There's so many different ways to do this. And I 100% like agree with that, but also do what's going to be within your means, like in your capabilities, because training is stressful, whether it be fellowship, whether it be like residency and doing an integrated program, like you've got to be also able to not have the outside stress of being in a city or an environment that is just not meshing with you. And I think when you interview, you get a better example of like how these people are going to be. And like, I genuinely loved my training at MGH, but living in Boston for 7 years was one of the hardest times of my life for all the others, besides it just being very cold. Yes, I'm a weather weenie, but like Boston and New England is a very harsh place to live for someone like me. Would I do it again? Yes, because I loved my program that much, but it is something to think about. And when I came home to California, I have never worked harder as I have in the last few months since I've started fellowship, but I've also never been happier. And a lot of that is the community here at SC, but it's also like being back with my people, like my good friends, my family, where it's sunny and things like that. So, that is something to take into account when you're picking a program. It's the culture of the program, the people you're going to have to spend hours with. It's the environment you're going to be living in. Like I personally could not be living in certain states and feel comfortable going outside. So I chose to not even apply to those states. If I didn't have the help of my family to be able to help me move cross country twice, I wouldn't have left California. So those were all things that went into that decision that I don't think people always talk about. But for me, they were very real limitations. And I know people who did not leave, whether it because they were married or because they were close to family or whatever reason, they just didn't want to leave a certain area, but like also they literally just couldn't afford it. So that's something to think about when you are applying. So if you're in one of those boats, don't bother applying to all these places that you don't want to be or don't want to go, because part of your success in this field is also knowing where you're going to be and what environment you're going to be living and training in.
So I'm just going to ask one last question before we take a few questions from the audience. And this is, what is a question you wish you would have asked or known before you went to fellowship or integrated vascular surgery residency? And I know that might be a little bit of a hard one, but I'm going to start with Dr. Morales.
I don't know. I think it's hard for me because I like knew the place. So I kind of knew what I was getting into. And And honestly, there's like there's very little things that you can ask and really know what it's like until you're doing it. Like I've been wanting to do this forever, and honestly, especially now, my last year and every year is special in a different way. It's been difficult, and like you don't know what you sign up for until you're actually here and you're dedicating your time and putting in the work, and realizing that it's hard. So I don't know. I don't think any question would have changed my mindset because I was so set on doing this. um so I don't know, like whatever is important to you, you should ask, but I don't think until you actually do it, you're really gonna find out what it's like.
I feel like, you
You
do.
know, yeah, I think so I'm kind of in a unique position because Irvine is a new fellowship program. I'm actually their second fellow. And this was a program that was top on my chart because I was there when Cedars-Sinai started their vascular surgery program. And being a part of that, seeing how the residents mix with the new fellow, and we used to do all the big aortal bifems and thoracoabdominals, and it was the chief resident and like the junior resident. Now you had a fellow, and so it was just so different. And so coming over to Irvine, it's kind of hard to say, like they didn't even know what to expect, right? But I think one of the things that I've learned, having been at Cedars and now having been here, is that something I would ask for or I would look into is like, what are their wellness programs? Like, what kind of wellness curriculum do they have? What kind of opportunities do they have for people to de-stress and kind of learn more about how they deal with stress and manage stress? Because anybody who's going into vascular surgery is going to be stressed out at some time or another. You're going to work, endless nights. Nights become days, days become nights. It's just all is a big blur. And you need to know how to decompress. And I think that that's something that isn't emphasized enough. Clearly, I was going to go into psychiatry beforehand and spent 3.5 years working outpatient mental health before going to medical school. But I think it's really important that you know your outlets and you know how to manage, bad outcomes, and you know how to kind of deal with this own internal conflict because you're so invested in your patients. And when something tragic happens, it's like, how do you deal with this? Or like when you're working tirelessly and you're just like nonstop working and you're like, oh my God, I don't even know what day of the week it is. It's just really how to deal with those things. And so understanding what, kind of resources are available to you at various programs, I think is really important, and something that may hit some people by surprise, like, whoa, what do you mean? Don't ask, how many days of vacation do I get, right? I mean, this is all kind of the same stuff. How much meal money do I get? It's like, no, what kind of resources do you have for professional development and growth? And how am I going to be, a rising star in vascular surgery when I finish this place,
Again, I have to intervene because this is beautiful. I am from the time where these were not questions we asked. These are not things we discussed. And I saw some of my co-residents be broken, right? Because we couldn't have these conversations because what Dr. Delgadillo said was not something we talk about. But now it's there. And I think one of the ways you actually catch how the program does is you go offline and you talk to the residents that are there, right? Because we're all gonna sell you the world. You're gonna say this is the best program in the world. We do 140 thoraco's a year. You're gonna be so great, but we don't tell you how that's gonna impact you, right? We don't tell you that 2% of those maybe we're gonna die, and you're the one talking to the family. I'm not gonna prepare you for that. It's on you. The fact that we can have this conversation up front, and thank you for bringing it up, is so important, right? Because wellness is, we created 30 generations of broken surgeons. And this is the first time we actually have a chance of not doing that. So look for that. But you find that between the lines when you talk to Paula after the interview, right? When you talk to Anna after the interview, are we actually taking care of you guys? Or will you say it at the interview for steps? So it's important. And Dr. McElroy said, the city you live, the people around you are maybe more important. That this is your top program. It's do great, but it's in a place that's not gonna make you happy. Be happy. Life is too short, and this is good, but be happy. Find a place where you are your own person. So thank you guys for bringing this up. It's fantastic.
Great. Okay. if no one else has anything to add, I'm going to start asking just a few questions that we have from our audience. I have what does networking for you all look like at the level that you're at right now? What kind of partnerships did you form and help you get to your future endeavors? Maybe Dr. Morales.
Yeah, networking for me is going to conferences, talking to people at conferences. I actually want to work in Southern California next year. So I don't know anyone there. So Dr. Rivera has helped me. I'm going to a conference next week in Vegas and trying to network there as well. So it's all about like talking to your attendings, people you meet at conferences, co-fellows, asking them how their programs are. And I think you guys mentioned it before, but there's different things you can go into, like academia, private practice, and then all of those look different. So you got to ask around.
And then from our audience, if you feel free to type any questions up that you have on the chat, and I can relay those questions to our panelists. And then what resources should you like if you had to pick one book to read during vascular residency or vascular fellowship, which book would it be, Dr. Delgadillo?
I draw from so many books, from like Rutherford's to like, the Moore book. It's I couldn't answer which one. I even have like a surgical techniques book that I'm constantly like looking up and saying, man, how do you know, what is this going to look like? And I don't know that there's a good one. Reading the papers, what is it, the main papers of surgery out of UCLA. I think that was like, Dr. Jimenez's book and stuff. And there are tons of good ones. I don't know that I have a favorite.
Yeah, I mean, my mentor lived by Rutherford's. I have Rutherford's, and then also Valentine's anatomy book. So like how to do the different exposures. I review that before every case. And then quick plug for audible bleeding. We have V-site review. But also I'm a big Rutherford's person. I like textbooks. And then there was one more book that I have that I can't seem to remember at the moment. But yeah, I just kind of bounce between the surgical atlas and Rutherford's. And then the papers, I guess 50 landmark papers. I have one of my mentors had actually been compiling her own kind of version of that, and it covers most of those papers and then keeps them up to date as well. So she has this really cool database that she shared with me, so that I've been using, and it's been really helpful. But it's pretty easy when your specialty has a set of landmark papers that like set it. So read all those. A good starting point is that landmark paper book, and it's out of the UCLA group.
Dr. Gowers, Dr. Delgadillo's ex-chairman at Cedars-Sinai, actually has a fantastic atlas, vascular atlas. The drawings are not very elaborated, but they look exactly like the anatomy you're going to find it. Although I appreciate Dr. Valentine's book, I think that's my favorite vascular atlas that you can actually, when I was a fellow, the residents were Cook County would actually have the book open on a stand while they operated by themselves. It's that good because the anatomy looks the same. So highly recommend it. I don't think there's new editions. But if you find the old edition, trust me, Dr. Valentine's book goes more into the details. Gowers goes into the perfect anatomy of what you're gonna find on each layer as you go, and I highly recommend it.
Was it the Zane Gawart's book? It's like Zane
Like
Gawart's
the
book.
yellow cover. I don't think they make it anymore, but it's good. And I actually gave it to one of my residents, and they didn't bring it back, so I don't know where it is.
Dr. Fujitani, who trained under Gawart's, has tried to get Gawart's to redo it, but that's still a work in process.
They have to. He was also in The Fugitive. He's the surgeon in the OR with Harrison Ford, so little tidbit of history in vascular.
That's right. He hired Ross Milner there, who I was with the other day for dinner, and is tiger. Yeah. Also, everyone knows everyone, like Dr. Rivera said. It's a very, very tight-knit community. So
Be nice
Also,
to it. You never know.
our reps, like all the different reps and companies like Medtronic will, help buy you textbooks, and Cook and Gore will buy you textbooks. So take advantage of that. I think for networking, I've also gone to conferences mostly to get free food from the reps. And going to vascular conferences is great because you never have to pay for a meal.
It's fun, and you go to the
Yeah.
best restaurant world.
Yeah.
Both Paula
But
and Karen have been to conference with me, so they know.
definitely take advantage of the fact that they all these companies have teaching stipends, and you don't have to spend $200 on your own textbook anymore, so they'll get them for you, which is really
And they're good
nice.
for networking too. These
Yeah,
reps
Absolutely.
the point that Paula makes, these are the people that are going to help you get a job, the reps, because they know everyone and they talk to everyone about it. So they're going to actually, if you're a general surgery resident, they can actually help you get a fellowship because they have worked with you in the OR, they like you're attending, and they actually know they are in everybody else or in the same area every day. So they know who's hiring, they know what they like, they know what they're looking for, they know what you bring to the table. And these are the people that have the insights, like, hey, the job is not posted, but so and so is looking for a new surgeon. And I told them about you, right? So be nice to your reps, learn from them. You're gonna learn a lot from them. They do this, you do it 5 times a month, they do it 5 times a week or more, or 10. So they learn from them, but also these are gonna be an anchor for educational opportunities and for your next position, either training or job wise. So they're good for you.
And they do move as much as we do. One of my reps here was actually one of my reps in Boston, and she left a couple years ahead of me, and I ran into an OR. I ran into her in the OR 2 weeks ago. She was like, "Hey," and I was like, "Oh crap!" Luckily, I was very nice to her as a general surgery resident and a budding vascular surgeon. I'm nice to everybody in the OR, but they talk just as much as the attendings do, and you spend just as much. They're up at 2 a.m. with you sizing grafts, just like you are. So.
I think one of the things that, just because I don't know exactly where everyone is in this process, but I feel like in medical school it was beaten into me not to work with industry, not to talk to industry. They're all bad, but I really would urge people in vascular surgery, they're our partners. We work with them regularly. They are team members that play a critical role in some of the outcomes of these patients. Kind of like Dr. Rivera said, they see these cases once a day. We see them once a month, if we're lucky, once a week, right? And so it's really important to kind of work with them and understand their role and how much knowledge they can share. Some of our reps, they're 20 years in the industry, in aortic industry, and so they really, really can be helpful when it comes to sizing in a pinch, in a rupture, and this and that. They're really, really very resourceful and useful, and especially when it comes to jobs. You just never know. I mean, I was golfing at Western, and next thing I know, it's like the global VP of sales for Gore. And he's like, "Where do you want to work next year?" Blah, blah, blah. And he's like, okay, I'm trying to play golf here. I don't know about jobs and stuff like that just yet. But anywho, it's been very, very helpful.
Thank you, everyone, so much. I think we're going a little bit over time, but thank you all for joining us for our fourth installment of Suing Success, the series we plan to continue to highlight various fellowship programs in surgery. Thank you to all of our participants who tuned in this evening. If you're interested in learning more about our organization or becoming a member, you can find us at latinosurgicalsociety.org and on various social media channels at Latino Surgery. And the recording of this event will be on our YouTube channel shortly.
And find us in social media. We're very happy to help you guys and talk to you about anything.
Yeah. And you should follow Montefiore Vascular on Instagram.
I might be there.
USC Vascular, Instagram and Twitter, and Audible Bleeding, Instagram and Twitter.
UCI Vascular. We also have a little Instagram page that our PD runs. So it's good stuff.
Thank you. This was fantastic. I think, first of all, again, follow my plea, Latino Surgical Society. I think it's a place where we can all merge, exchange these ideas, and become a force that actually can drive policy change and make it better, not only for us, but for our patients. So I commend you for being here. I think this was great.
Thanks for inviting us.
Thanks so much for having us. It was an honor to be here.
Yeah, thank you very much.
Thank you, everyone.
Thank you.